Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
Good evening. This is Dr. Jeremy Stich. Thank you for tuning in. We would like to discuss some COVID updates. This is March 21st. In the United States, the CDC did not report any statistics over the weekend, so today's assessment was gathered from Johns Hopkins Center for Systems Science and Engineering. The Johns Hopkins data reports 22,177 cases and 278 deaths in the United States. This represents a 56% increase in cases and 85% increase in deaths from the previous day's data. Let's look at the global updates. Italy today reported 793 deaths in one single day. This is the largest increase in deaths since the start of the pandemic in one day. Now, also the U.S. response has a couple updates worth mentioning here. As of this morning, 75 million Americans, that is 1/5 of all the U.S., are under direct orders to stay home. Health officials in Connecticut, Illinois, New York, Texas have followed California's lead and issued orders for residents to stay home except for essential workers. We also have some updates in testing recommendations coming out of New York City and Los Angeles. We know that there is a testing shortage, and authorities in those cities are recommending that healthcare providers only test patients for COVID-19 if those results would change the course of treatment. We presumably think this means hospitalization, so some changes, not too surprising. Finally, the CDC has issued some new guidance this week for healthcare facilities facing severe shortages in personal protective equipment. I believe that is almost every healthcare facility, and that practically means they are recommending that we consider options that are, quote, not commensurate with U.S. standards of care, end quote. This includes reusing masks and using homemade masks. So practically speaking, don't be surprised if you go to a clinic or healthcare facility and you see some non-traditional personal protective gear. Now, I'd like to move on to discuss some updates specifically for our clients and our patients. First of all, I want to say rest assured we are still open, but we are definitely executing a telemedicine first protocol. So I want to remind everyone what that looks like. If you need to see your provider, call the office or send a direct message or secure text message to your provider. All visits will begin with telemedicine. Once that screening is complete, we can then determine if an office visit is necessary and appropriate. The goal here is to limit physical traffic into and out of the office so that it's still accessible for those who need it. We don't want to spread this disease, but we also want to keep our doors open as needed for urgent needs. We're definitely postponing routine visits, so routine physicals should be delayed until further notice. We are updating our treatment protocols, and we are definitely staying abreast of the most consistent and up-to-date recommendations regarding remote visits and empiric therapy. So please rest assured that we are doing our best to keep up with all of that and definitely utilize telemedicine. Lastly, I'd like to provide a quick translation of the latest research. We have heard Drs. Dawson, Mallon, Goodman, and Stone give quite a few updates on research, so I want to talk about what that practically means for patients, clients, and individuals who are listening. Number one, we've seen a expanded list of symptoms, of presenting symptoms of COVID-19 to include GI symptoms such as upset stomach, diarrhea. So we used to think those were good screening tests to rule out the disease. That is no longer the case. Secondly, risk factors for severe disease are also increasing to include specifically chronic kidney disease. As this infection spreads to bigger populations and new populations, we are likely to see this list expand even more. So stay tuned there. And the third and final update from the data shows us that co-infection rates are much, much higher than we previously suspected. Some studies showing as high as 22% rates of co-infection. So initially, we were testing people for things like other coronaviruses, rhinoviruses, influenza, and using those to rule out COVID-19. It does not look like that is going to be a possibility any longer. Next up, let's talk about some new literature. So this was a pretty quiet day from the literature front. There was one article called Managing Cancer Care During the COVID-19 Pandemic. This came from the Journal of the National Comprehensive Cancer Network, and I'd like to spend just a minute on this because it highlights the challenges of caring for those who require frequent access to hospitals or clinics, but are also at severe risk. And I think what this article does is it teaches us two pretty valuable lessons. The first is that we should be utilizing telemedicine first instead of going directly to these clinics. And secondly is one of more of a humanitarian message, which is to consider others. This is not the time to be visiting medical facilities if you are not sick or if you are simply worried about being exposed. We need to think about those who really need critical access to these facilities. So definitely utilize telemedicine and think about others before just being tested out of worry. I think this is just a general good lesson for everyone. Lastly, I want to tackle some questions. So we've had a couple interesting questions posted. The first one, an individual asked, is it practical to have a bag mask ventilator at home and for lay people to be trained to use this in case of a worst case scenario? In the short term, yes, I think this is potentially valuable. You could see a scenario where delay to a first responder might be a little bit longer than usual. So being able to provide rescue breaths could definitely be beneficial here to not expose an individual but save someone else. But long term, it's probably not very practical because using a manual bag mask for a prolonged period of time is just really hard for one individual to use. But it's a great question. We've had a number of fasting questions. This one was a specific one about a prolonged fast. And this individual asks, is there a benefit to fasting 72 hours or longer if an individual is asymptomatic? We have to rely on the physiology here because there is no direct data since this COVID-19 is a new virus. But physiology suggests that early on in a prolonged fast, we can see a slight increase in inflammation and slight weakening of the immune system. After about 72 hours, this may balance and you might even see a boost in immunity, but I would certainly say there is some risk to doing this early. It is not something I am recommending or personally doing. So some great questions. We appreciate everyone tuning in for these updates. Please stay tuned and we'll keep you abreast of any further updates. Everyone be safe and make sure we're staying home and not spreading this around as much as possible. Thank you.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at WildHealthMD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.